Now, it's come up a little bit in this conversation, but I'm curious the difference between the terms illness, anxiety, hypochondria, health anxiety. Tell me more about those.
Well, there's a. I'm going to talk at another segment about the history of hypochondria, but hypochondriasis refers specifically to the fear that you have a specific disease. Illness, anxiety, probably is a broader group where you generally might worry about uh, getting an illness. So, for example, if you have obsessive compulsive disorder, you may fear that you are going to get an illness by shaking hands with someone who's sick. So, that person would have a type of illness anxiety. Certainly, the hypochondriac has illness anxiety. And sometimes people have certain phobias and they just don't want to even hear anything about, let's say, cancer. So it's not that they think they have cancer, and it's not that they're checking themselves over and over again, but they will just avoid it. Uh, so I don't know what you have to say about
Yeah,
that.
I mean, I guess the way I think about it, if it's helpful, is that you kind of have a spectrum. And at one end, you have people who are primarily anxious and worried and don't really have that much physical distress. The symptoms may actually be quite minimal, or sometimes they don't even have any symptoms. All they have is the idea they're sick. So someone will say they're convinced that they have AIDS, and I'll ask the patient, well, what symptoms do you have? Do you feel sick? What makes you think you have AIDS? And they say nothing. I just think I have it. Nothing's bothering me. I just keep believing that I have it, where it's just a really pure idea. And that's much more in the realm of an anxiety problem. And then you have people at the other end of the spectrum who have mostly a physical distress and aren't all that concerned about what it might mean, what the significance is, what's going to happen. They just want relief of the distress, of the pain or the fatigue or the dizziness.
So it sounds like they're different subtypes, in other words.
So different subtypes of illness, worry, and somatic preoccupation. Yeah. Actually, that brings up a point, which is you were saying that 1 in 20 people in a primary care office might have hypochondria, but I've seen studies where something like 25% of patients in a primary care office have unexplained medical symptoms. So maybe it would be worth clarifying what the difference is between a medically unexplained symptom and hypochondria. Um, Arthur, you want to
Yeah, I
touch
mean,
that?
I think it's an important point. There's a larger group of people who go to the doctor with some symptom that they think might be medically based, and it turns out it's not medically unexplained complaints. But what we've been talking about today is people in whom that's a persistent, ongoing concern that doesn't respond to reassurance, so that it's not a temporary sort of issue. The doctor says, you're doing fine, that mole is not malignant, you don't have to worry about it. And the kind of people the much more commonly people say, terrific, that's all I wanted to hear. I'll see you next year at my annual physical. Hypochondriacal people tend to respond to that with, are you sure? How do you know that? Don't you think a dermatologist should see it? How can you be sure without biopsying it? The doctor's attempt to reassure them generally just makes it worse. They become even more alarmed. The doctor is missing it. Now it's even worse because they know something's wrong and the doctor's missing it.
Maybe we should stop at this point and just explain that this is one of a series of segments on hypochondriasis. Dr. Harding, in addition to being the MC here, is also a psychiatrist herself and uh, has been working very intensively on a study of hypochondriasis, which you can learn more about by going to a website. Your website is,
Ours is thehealthstudy.com.
and ours is more complicated. It's
It's illnessworry.cumc.columbia.edu.
okay. So at a later, I think this is one of 8 segments perhaps, and so at a later segment we'll talk more in detail about the study. So thank you for joining us, and watch one of our others.